Good evening, everyone. My name is Dr. Perry Meyer, and I'm the Medical Director at the Meyer Institute in Hamilton. It's my pleasure to welcome you all to tonight's webcast on transdermal doxycycline, a new modality for diabetic wound care, brought to you by DELIVRA. Our learning objectives tonight, we're going to get a quick understanding of the importance of diagnosing and treating diabetic foot ulcers as one of the often overlooked complications of diabetes. We're going to learn how a topical doxycycline product can be used for the treatment of stalled diabetic ulcers. We're going to gain an understanding of how doxycycline, compounded in this very unique delivery system called DELIVRA in the form of a cream, provides better stability and deeper penetration of the active ingredient, in this case doxycycline. We're going to be learning how DELIVRA-DX, or the compounded doxycycline in DELIVRA, can be utilized in the treatment of diabetic foot ulcers in a case series. And finally, we're going to be learning how DELIVRA-DX can be compounded and safely delivered across Canada directly to patients with a valid prescription. This is my disclosure slide. So I'd like to introduce the panel tonight. Again, my name is Perry Meyer. I'm the Medical Director of the Meyer Institute in Hamilton, Ontario. Next to me is Dr. Joe Gabrielli, who is the Chief Scientific Officer at DELIVRA. And on my far right is Farsan Dadfar, who is the Pharmacist Manager at NKS Health in Toronto. We're all going to be speaking about different aspects of diabetes and DELIVRA and the compounding of doxycycline in DELIVRA, and each of us have our own expertise. We're going to try to share with it a little bit about that expertise with you tonight. I'm going to first start about talking about diabetic management challenges. We will be talking about treating the diabetic foot and its complications, examining diabetic wound care treatment gaps, and then obviously looking at a new treatment for the treatment of diabetic foot ulcers and some clinical evidence that we've acquired over the past couple of years. Treating the diabetic foot is a problem that is ages old. Back in 1901, the image on your upper left is of a pioneering surgeon, Ernst von Bergmann, who is shown here performing the first filmed lower limb amputation. And now it's 2016. You would think that things have improved over the years in the treatment of the diabetic foot, and there should be a reduction in these somewhat brutal operations in treating diabetic wounds. But in fact, the amputation rate has risen, and this is primarily because the incidence of diabetes has risen over the past many years, but also because the treatment modalities used in the treatment of the diabetic foot really haven't kept pace with this increasing incidence. So obviously, novel treatments in the treatment of the diabetic foot are very handy in our work, in our line of work, and we are always looking for new and exciting treatment modalities to help us along. So some statistics about diabetes that are quite shocking and not very well known. Diabetes contributes to approximately 80% of the non-traumatic amputations performed yearly in the US, but it's the same here in Canada. Having a diabetic wound doubles one's chances of dying at 10 years compared with someone without diabetes. And someone on dialysis who's had an amputation, the mortality is extraordinarily high at 72% after 2 years. A diabetic foot ulcer doubles the mortality and heart attack risk while increasing the risk of stroke by 40%. Every 20 seconds somewhere in the world, a limb is lost as a consequence of diabetes. Now, only 2 years ago, that was every 30 seconds. By 2030, about 500 million people will have diabetes, which is about 10% of the world's population, but that's probably an underestimate. Diabetes kills more people annually than breast cancer and AIDS combined. Every 5 seconds a person develops diabetes, and every 10 seconds someone dies from it. So how does diabetic foot disease compare with other diabetic complications? We know that the infected diabetic wound is the most common reason for hospital admission for a diabetic. It accounts for the largest number of hospital bed days used for diabetic patients. 1 in 5 leads to a lower extremity amputation. And after an amputation, major amputation, either below or above the knee amputation, 50% of those people have the other limb amputated within 2 years. And 20 to 40% of the total cost of diabetes are related to the diabetic foot, which is an extraordinarily high amount of healthcare dollars used to treat this one complication. And obviously with these statistics, you can see that the diabetic foot ulcer is the most prevalent complication of diabetes, bar none. So there's some challenges in the treatment, in treating diabetes and its complications. The complications, there's a profound lack of awareness of the complications, and in our world, the diabetic foot is a major complication for which most clinicians have very limited knowledge of that it even exists. There is a poor understanding of the interplay of diabetic targets and end organ damage. There is a very long time continuum between the onset of diabetes and the onset or the development of the complication. So there is the association between diabetes and the complication is not understood well by the patient because there's such a long time between the two. And society's common impression of what medicine can do for them. They believe that medicine can fix what is ailing them. They believe that taking the medication is all that they need to do. And they also believe, mistakenly, that medicine can treat the things that go wrong with them in diabetes, and that's clearly not the case, because once something develops, a complication develops in diabetes, it's permanent. You can't reverse it. So there are some treatment gaps in the treatment of the diabetic wound. There are very few dedicated wound clinics across Canada. That may be because wound care is not all that attractive to physicians. There's a very, again, poor understanding of the problem. Lack of funding for offloading devices is a chronic problem here, particularly in Ontario. This is particularly bad for the diabetic foot because offloading or taking the pressure off of a diabetic wound is the mainstay of treatment for the successful treatment of the diabetic foot. There's a lack of, there's advanced wound treatment modalities are also not accessible to most patients as they are somewhat expensive and again need to be administered by someone who is skilled in the treatment of the diabetic wound. Funding is a chronic problem across Canada. The government believes that the diabetic foot is not as serious as it is. The lack of robust randomized controlled trial evidence kind of fuels that, but a lack of communication with government officials who matter is also part of the problem that funding is lacking. And again, lastly, there are a few physicians that can administer this very specialized treatment. So let's talk a little bit about doxycycline as a treatment option for diabetic wounds. Doxycycline is a very old and versatile antibiotic. We know it. It's been around for a long, long time. It is unique in that it has both antibacterial and anti-inflammatory properties. The anti-inflammatory properties are particularly desirable in the treatment of the diabetic foot. We are interested in the anti-inflammatory properties because it helps shape the wound environment by modulating these proteolytic enzymes that keep the diabetic ulcer in an inflammatory state and keep it in a chronic state. So some benefits of topical versus oral doxycycline. We know that almost all oral antibiotics have side effects, but one that is almost universal is the GI upset, and that often limits the effectiveness of that antibiotic. The topical use is more localized and targeted, and therefore more desirable. Local application can directly affect the wound tissue as opposed to the whole body. So past doxycycline topical preparations have had, they've been used in the past, but with limited success. And two issues that have limited the success of these preparations have been stability and penetration. And until now, this has limited the local delivery of doxycycline. So DELIVRA-DX is a new topical option. It is extremely stable, and our original preparations were about stable for about 6 months, but it's gotten better since our initial foray into this. The ability to penetrate both skin and wound bed tissue. Now, it doesn't just penetrate superficially, it penetrates quite deeply into the wound bed, and this is different than other preparations which basically stay on the surface. Maybe 10% gets through the skin to affect the underlying tissue. We've seen effectiveness in preliminary studies on multiple wound types: diabetic foot ulcers, obviously, venous leg ulcers, which are very difficult wounds to treat, scleroderma, so these rheumatologically mediated ones, scleroderma, pyoderma gangrenosum, and lupus also have seen unusually good results using DELIVRA-DX. So in our preliminary study, we looked at 164 diabetic ulcer patients and tracked for improvement with DELIVRA-DX, and we saw about 70% of them got overall improvement or completely healed, and that is something that piqued our interest, and certainly is something that is somewhat unusual for a topical preparation, and we were obviously very excited about these results. So future work in development right now, we are focusing on obviously the diabetic foot, but also venous leg ulcerations are a very, very big problem and are very poorly treated. We are looking at combining DELIVRA-DX with other agents and utilizing the inflammatory effects of DELIVRA-DX with late phase phenomenon, and specifically taking that property of DELIVRA-DX and then applying it in different scenarios. We're going to take a look at this little animation about diabetic foot ulcers.
Diabetic foot ulcers can be caused by a variety of issues not typical in healthy adults, and can quickly get out of control and lead to serious wound infections. DELIVRA-DX, doxycycline hyclate compounded in DELIVRA's transdermal base cream, works quite uniquely, facilitating transdermal active ingredient stability and ensuring deeper penetration of the active drug into the wound bed, two significant improvements over earlier generations of topical doxycycline formulations. DELIVRA-DX is a new treatment modality that has shown unique and very encouraging results to date by delivering doxycycline deep into the tissue of the wound bed. By stabilizing the active ingredient for transdermal delivery, DELIVRA-DX ensures that doxycycline provides important anti-inflammatory effects directly to the wound site. This targeted anti-inflammatory effect is particularly desirable when treating DFUs because it is hypothesized that this can help shape the wound environment by modulating proteolytic enzymes, which in turn allows for the tissue to move through the normal phases of repair and healing.
So that's a good illustration of how DELIVRA-DX works and why we're so excited because of its ability to penetrate into the wound bed deeply. The question people are asking right now as to why try something new. Well, the diabetic foot carries with it an extraordinarily high 5-year mortality rate. In fact, the diabetic foot has a 5-year mortality rate that's higher than almost all cancers save lung and pancreatic cancer. So this is a very important statistic to understand, and one that needs to be shared with our patients in order to motivate them to do the things that we need them to do, but also to illustrate to clinicians how important it is to treat the diabetic foot successfully. So let's talk a little bit about wound healing in general. The primary mediators of wound healing are twofold. One is growth factors and the others are cytokines. So the growth factors are the fuel that stimulate cell migration and proliferation and beef up the tissue to allow for epithelial cell migration and landing, so to speak, a healthy landing zone. Now cytokines, on the other hand, are the steering mechanisms. They guide the epithelial cells into place onto this well-prepared, healthy wound bed, and they include platelets and macrophages. There is a lot of cell-to-cell signaling with the utilization of cytokines, and cytokines also control gene activation involved in cell migration and proliferation. So these slides that we have here are beautiful illustrations of what this wound induction and movement through the chronic inflammatory stage, which is this, through proliferation and then cell migration. So here we have a chronic wound, which is clearly showing devitalized base, craggy edges. The base is obviously sluffy and has a lot of devitalized tissue. So we debride that and remove all of the dead and devitalized tissue. This is important because any wound bed that has dead or devitalized tissue within it will not heal. And you could understand why, because in that dead and devitalized tissue, all of the growth factors and cytokines are not active. They would be inactivated by this necrotic and devitalized cellular debris. So you have to remove that to reset the wound from a chronic state into an acute state. And with that, you apply treatment modalities, advanced wound treatment modalities, in order to stimulate the bed to granulate, to get into the proliferative stage. And this is what it looks like when we are successful in getting that to happen, with whatever modality we might be using. So in this case, if you look at the bed, you can see that it is nice, beefy, red, and velvety in appearance. And the wound edges that went from being very craggy and irregular now are smoothed out and linear. The wound edges are also rolled down, and that's an important sign because that indicates that the epithelial cells are migrating onto or flowing onto the wound bed. And this is what it looks like in a beautiful example of this sheet-like action of the epithelial cells sort of washing over that granulated bed that is healthy, calling them in and causing the wound to heal. And this is a very, very good example of cell migration, and one that we can look for as evidence to see whether our treatment modality is actually working. So we're going to talk about a few case examples using DELIVRA-DX. And unfortunately, so we have, the reason why we're a bit late in starting is we had a little bit of difficulties with these cases. So I'm just going to talk you through the first one here. And this is a case of a gentleman who had an ingrown toenail. And we often talk about diabetics getting their nails cut and how important that is. Well, this is a good example of why that is. So here's a gentleman who had a simple ingrown toenail that went on to become an ischemic wound because this man had very poor blood supply. And so a simple ingrown toenail can lead to a potentially limb-threatening wound. The subsequent slides show the evolution of this, but we debrided this wound. We had partial restoration of blood flow through a vascular surgeon doing angioplasty, but not, it wasn't stellar. There still was quite poor, relatively speaking, blood flow in the foot. We carefully debrided this wound and applied DELIVRA-DX to the wound bed. It was at intermittent stages was very stalled, and here in December, so almost a year later, we have a healed wound, durably healed, that will allow the patient to wear shoes, and we are confident that this wound is not going to reopen because the tissue is weak. So this is another case, and this is was a very challenging case of a patient who was awaiting a kidney transplant. She was very sick. These wounds were extraordinarily painful, and she had these wounds for 14 months. Now, so she presented to us. They were in a state of chronic state, very difficult to debride. We were able to start the debridement off using another treatment modality, which was an enzymatic debrider, which started to prep the wound. But again, the wound was stalled. We were only able to change that or altered that pattern when we applied DELIVRA-DX. So after we started that, we had a fairly dramatic change in the behavior of the tissue and a rapid contraction of the wound, which also, as a consequence of healing, dramatically reduced the amount of pain that she had. And to understand, she weighed about 90 or so pounds. She's a very skinny woman. She was on a huge amount of narcotics, something in the order of 24 or more milligrams of hydromorphcontin twice a day. That's a huge dose for such a small woman, and this was a result of this chronic wound not healing. We were able to get it to this point where she was now markedly reduced in her narcotic use down to about 3 milligrams every 12 hours, and ultimately the wounds healed beautifully, and she went on to successfully get a kidney transplant, and she is alive and well today as a result of DELIVRA-DX being able to take this stalled wound and reactivate it and put it on a healing trajectory. So tonight we've been talking about diabetes, diabetic wounds in particular, and the marked increase in amputation and mortality risk for diabetic patients. There is a profound lack of awareness amongst physicians and very few treatment options for bringing wounds back to good health. Topical doxycycline and the DELIVRA-DX has a twofold benefit for treating diabetic wounds, but the challenge was that in previous preparations there was poor stability and a lack of real penetration into the tissues. DELIVRA-DX early on now has shown extremely promising benefits for many types of diabetic ulcers, especially when the wound is stalled. So I'm going to hand over to Dr. Gabrielli to talk a little bit about the story about how DELIVRA was invented, and the story behind it is a very compelling story. Joe?
Thank you, Dr. Meyer. My name is Joseph Gabrielli, and the topics of discussion tonight involving the DELIVRA delivery system platform. I'll give a brief background on the company and its vision. DELIVRA as a novel transdermal delivery system platform. Current transdermal programs that were in our R&D program, and how DELIVRA addresses the challenges of doxycycline for diabetic foot ulcers. So about the company, we're a Canadian company that has successfully delivered and commercialized a revolutionary and proprietary technology for a superior transdermal delivery of pharmaceutical and natural molecules. In just 10 years, based on extensive research and development work, focused investment, DELIVRA has developed into an emerging leader in transdermal delivery in pharmaceutical and natural health industry. It all started for a personal reason. I was a professor at McMaster University when my wife fell ill about 10 years ago, had a tumor in her maxillary of the face, and following 3 surgeries, this fibromyxoid sarcoma was removed, but on the 3rd attempt, the surgeon had to remove the trigeminal nerve in the maxillary region of the face, and she developed neuropathic pain known as trigeminal neuralgia. She was bedridden for over 15 months. She couldn't take the anti-epileptic medications that the physician was giving her for the pain, and she couldn't take any kind of oral medication. It was upsetting her stomach. It was giving her hypertension, and she was getting a rash and so on, all the side effects of oral medication. And at the time, the physician that was treating her said, why don't I try to develop a delivery system that can go mixing the drug and go through the skin directly to the source of the pain. And that's exactly what I did. So the main question was, what if we can deliver a medication right through the skin with a cream deeper than ever before in a more targeted, specific manner? From this point, I had done some PR work, and the federal government took notice, and they offered me a laboratory as a partner in the National Research Council building in the East Coast. And here is an example of one of the fundings I got from former Prime Minister Harper for $2.86 million. And since then, I have funding of over $5.5 million in the last 3 years that help develop this novel innovation. So I'd like to talk a little bit about the delivery system itself. To validate it, what I did was I used natural molecules that I could bring in through this delivery system, water-soluble molecules that are very hard to bring through the system orally because of their poor bioavailability. And we developed these live relief pain products for myofascial pain, and for neuropathy, diabetic neuropathy, and for cuts and abrasions and so on. And that was just basically to validate the delivery system. Our facility, our R&D facility, is in Charlottetown, Prince Edward Island. We have 6 full-time employees, 5 PhD level scientists. It's an analytical, bioanalytical, and molecular biology laboratory. We do project design and execution, preclinical and clinical work that's done there in Prince Edward Island. The actual formulation laboratory is in Montreal, Quebec, where we have a facility, a DIN FDA Health Canada approved facility, and here we do micro and pilot scale formulations and do stability testing. So the novel transdermal delivery system itself is basically, this is a pictorial diagram of the skin, and I think I'll show you a video now of the actual delivery system that's much, they better explain it than I can.
DELIVRA, a therapeutic transdermal technology, delivers pharmaceutical and natural ingredients through the skin. The patent-pending DELIVRA technology provides for rapid penetration, followed by the slow release of active ingredients at the source for safe and effective results. DELIVRA is a novel transdermal cream which can deliver a very broad range of molecules and compounds. DELIVRA's groundbreaking technology uses multifaceted liposomal encapsulation, wrapping around molecules for safe transport to supply active ingredients through the skin. DELIVRA's emollient base cream intercalates with the skin, introducing molecules to the body by permeating and transporting compounds through the skin. In addition to scientifically proven increased dermal absorption and deep penetration, DELIVRA can transport larger molecules like peptides or water-soluble compounds. By transferring active ingredients through the skin, DELIVRA's transdermal technology introduces a new vision for medications, transcending oral side effects of digestive upset and replacing the archaic needle. DELIVRA, when mixed with an active ingredient and applied topically, penetrates the first layer of skin, the epidermis. However, unique to DELIVRA is its ability to go into the deeper layers of tissues based on the requirements of the active ingredient. The dermis, or second layer of skin which DELIVRA can penetrate, contains pain pathways. This innovative topical delivery allows for a more targeted administration of pain medication. The third and deepest layer of skin DELIVRA can infiltrate is the hypodermis, or subcutaneous tissue, which contains our blood supply, fat tissues, and nerves. Where required, DELIVRA is capable of entering the bloodstream at the hypodermis level with the added advantage of a slow release of active ingredients, which avoids the peaks and valleys associated with other drug delivery methods. The key benefits of DELIVRA include a delivery system comprised almost entirely of natural ingredients, a multifaceted liposomal encapsulation of active ingredients for safe transport through the skin, a non-invasive emollient delivery system conforming to and intercalating with the skin, deep penetration, the ability to deliver large molecules, approximately 1,400 Daltons, a controlled release of active ingredients. These innovative benefits are what make DELIVRA a breakthrough topical delivery technology for pharmaceuticals or natural compounds. DELIVRA, a safe, effective, and more customized active ingredient delivery option versus oral medication.
So the most important part of that presentation is in the formulation process, we are able to use different techniques such as conjugation methods, caging methods, so we can actually target specific molecules to go deep into the skin layers and prevent them to go into the systemic circulation, while other pharmaceuticals such as anesthetics or bioidentical hormones, we can prevent depot effect and we can get penetration specifically into the systemic circulation. What's important with this delivery system is it's a sustained release. It's almost as if we have made a multilaminar structure like an onion, where the pharmaceutical or natural molecules get entrapped in the layers of the onion, and you get a slow release or sustained release. And what's really important here is you can increase the half-life of a drug. So if you have a half-life of a drug like ibuprofen that has 2 to 3 hours, if you use our DELIVRA delivery system, we've shown through kinetics, pharmacokinetic studies, that we can get 10 to 12 hours of relief of ibuprofen by this sustained release system. So it's innovative and disruptive, and that's why the federal government has taken such notice in our delivery system. We have numerous programs, R&D programs, both at the preclinical and clinical levels. Because we're focused on metabolic diseases such as diabetes, and Dr. Meyer was explaining about the importance of an unmet need of diabetic foot ulcers, many of these patients also have a comorbid pain issue. If it's not myofascial pain, it's also neuropathy. So we have now been able to bring in NSAIDs like ibuprofen, naproxen, meloxicam, diclofenac, and so on. Celebrex is a COX-2 inhibitor. But we also can bring in drugs like sildenafil and tadalafil, which is Viagra and Cialis, not more for erectile dysfunction, but more for vasodilation of the microcirculation in diabetic foot patients with diabetes. We've also been involved with hormones, peptides that are very, very hard to bring in orally because they get chewed up when you take them orally, and the only way you can bring them in other than transdermally is by injectable, which is a more invasive method. So there's so many different types of medications, natural and pharmaceutical, that are involved in the metabolic diseases such as diabetes, not just the diabetic foot ulcers. So the DX formulation itself with doxycycline, the challenge is that doxycycline is an antibiotic. It's a tetracycline-like antibiotic that is very unstable and is prone to oxidation. So past formulations had issues of penetration and the issue of oxidation. And with our R&D team in the East Coast, we've been able to cage doxycycline using caging methods and metal chelators that allow for its stabilization for over 6 months, which is unheard of. Usually doxycycline within 24 hours will go in solution from a nice clear to a very muddy dark brown color due to the oxidation of the molecule. And the delivery system itself, as I said earlier, is different than other delivery systems in that it's more targeted specific to get deep down into the wound bed. And I think that's why Dr. Meyer is getting very good results with our particular delivery system. So the DELIVRA technology benefits, as I explained earlier, it forms these laminar structures and liquid crystal technology that entraps the doxycycline molecules for transport. The lipid profile of DELIVRA base is similar to that of the skin, that it basically, once you would apply it to the wound binder or the skin, it intercalates with the skin, becomes one, and that's where you get penetration and this slow release that I explained earlier. And DELIVRA uses many antioxidants, conjugation methods, caging, metal ions to stabilize the doxycycline molecule to provide this long-term stability that was unheard of up till today. So basically, in summary, doxycycline in DELIVRA provides greater stability, a quicker onset at the source, deeper targeted penetration into the wound bed, and a slower release of the doxycycline, so you get a longer half-life of that particular drug. I'd like to pass it over to Farzan Dotfar of NK Health, and I'd like to thank you very much.
Thank you very much, Dr. Gabrielli. My name is Farzan Dotfar, and I'm a pharmacist from NKS Health. I just want to say that I'm very honored to be involved in this team of experts in presenting this webinar to you, and I can say for myself and the rest of the NKS team that we're extremely proud to be involved in the provision of this exciting compound, doxycycline, in the DELIVRA-DX space for all patients across Canada. I'll start by giving you a brief history about NKS Health. NKS Health was founded in 2009 by Nancy Simino, who is a pharmacist and had an extensive history of owning and managing pharmacy stores across Ontario. Nancy found a gap in the provision of healthcare for patients with chronic conditions, and she was inspired to establish NKS Health to offer a different type of pharmacy experience in more complex areas of medication management. Her passion and vision for always putting the patients first, and her commitment to innovation and health promotional strategies had a quantifiable impact on patient outcomes, and this was specifically recognized by the Ontario Pharmacists Association in 2014, where she was the recipient of the Specialized Pharmacy Practice Award for her achievements. Today, we're honored to say that NKS Health is one of the leading and the largest specialty pharmacy across Canada. Our mission statement speaks for itself. Our areas of expertise involves provision of injectable and infusible medications, as well as compounded medication, which can be specifically customized and individualized to meet the needs of your patients. Founded on the principles of exceptional patient care, NKS looks for opportunities to work with hospitals as well as clinics to improve patient outcomes, and then meets these needs through patient education, medication preparation, compliance management, and of course exceptional customer service. We believe that by combining the appropriate medication with patient education and appropriate support services, we can improve your patient's outcomes. And this is what we're committed to. Over the years, we're proud to say that our clinical team has collaborated in different research trials through affiliation with research centers and teaching hospitals. And we've also collaborated with more than 150 specialists across the province. And we've served over thousands and thousands of patients to achieve better health. And this has been possible through our 3 locations at NKS Health. Each of our locations have been designated to serve a different geographical area of, for the provision of the doxycycline in the DELIVRA-DX space. We've designated our London location to serve Western Canada. Our Mississauga and Toronto headquarters will be serving Central Canada, as well as the province of Ontario. And our Ottawa location with English and French-speaking staff will be proud to serve Eastern Canada. Down here you can look at our website and also our email if you need to reach us for any inquiry. On this slide, we've outlined all the steps involved in the prescription fill process at NKS Health. Obviously, with any prescription fill process, it always starts by you as a prescriber, by giving us the opportunity to get involved in your patient's care. From the point where the prescription is generated and it is faxed to NKS Health, then we will take charge of your patient's prescription and medication and make sure it is safely and securely delivered to their doorstep. The prescription for the Doxycycline and DELIVRA-DX space will be consistent with your current prescribing practices in your province. It will obviously entail the patient information, the prescriber information, as well as signature. And as for the active ingredient, doxycycline needs to be noted to be compounded in the DELIVRA-DX space at 2%. The directions for use will be at your discretion, and the medication can be ordered in increments of 35 grams. Once the prescription is generated, then it can be simply faxed to NKS Health at our confidential fax line, and then an NKS staff will receive the prescription and process it. Your patient will be contacted to screen for allergies and to create a profile, and then we'll establish coverage based on either third-party insurers, government plans if possible, or perhaps we'll arrange for an out-of-pocket payment with your patient. Doxycycline 2% will then be meticulously compounded in the DELIVRA-DX space with the latest medical knowledge and an innovative formulation which will ensure the maximal stability of the product for about almost 6 months or possibly more. Using a state-of-the-art technology, we're involving and incorporating particle reduction, which ensures a homogeneous and a consistent mixture for your patient. As Dr. Gabrielli mentioned, doxycycline is notorious for getting oxidized when exposed to air, so we'll be conducting continuous quality assurance batch testing to ensure the stability and the potency of our product. An NKS Health pharmacist will then contact your patient to counsel them on the proper use of the compound, counsel them on the potential side effects or adverse effects, and to resolve any potential drug-related concerns. I just want to emphasize that at any point during this prescription fill process, your patients will have access to an NKS pharmacy to answer any questions related to this compound or to even resolve any potential drug-related concerns that they may have. Once the patient is counseled on the proper use of the medication and the delivery arrangements have been made, Then the medication will be packaged with a customized and patient-friendly information leaflet and delivered with our highly developed cold chain standards if need be. Then the medication will be delivered to your patient's doorstep. Our patients in Ontario will have the privilege of receiving the medication through our personalized NKS delivery staff. And as for rest of the Canada, we'll be delivering the medication through registered mail, which gives us the opportunity to track the shipment and ensure they've securely and safely received it by providing their signature. Last but not least, our adherence specialists will ensure compliance by having timely refill reminders to patients. Our pharmacy team will also collaborate with the prescribers to ensure optimal patient outcomes. This can be done through sending fax authorization for refill request, or perhaps to communicate with the patient to schedule follow-up appointments if further assessment is necessary. Hopefully I've been able to summarize and give you an overview of how NKS will be involved in the provision of this exciting new compound. First and foremost, we want to make this process as simple and seamless as possible for the prescribers. So if we can incorporate, if we can provide you with customized prescription pads for the DELIVRA-DX, we'll be more than happy to do so, and please do let us know. We've incorporated state-of-the-art compounding procedures and implemented a pharmacist-driven patient counseling and education. And our adherence team will ensure that your patient stays on track with their treatment throughout the course. We believe by removing these type of barriers, we can continue to encourage your prescribing practices and to receive positive feedback from the patients, and ultimately to improve your patient's outcome. Thank you for listening, and thank you for allowing NKS Health to be involved in your patient's care. I also wanted to mention that there will be a booth 609 at the CAWC conference in Niagara Falls, so please don't forget to visit us there.
On behalf of DELIVRA, I would like to thank Dr. Gabrielli and Farsan for the presentations, and I'd like to thank you, our viewers, and we welcome your questions. I hope that the webcast has been a valuable tool in understanding this unique delivery of doxycycline transdermally. And lastly, we want to encourage you to complete the online polling questions if you have not heard yet, and have had a chance, and I hope that you enjoy the rest of the evening. We welcome some questions now.
So our first question, when is a wound really stalled?
A wound is stalled when it fails to progress beyond the inflammatory stage, usually at around 4 weeks. But we look for inflammatory markers such as devitalized tissue, failure to contract. I mentioned in the presentation some signs of a healing trajectory, like straightening of the wound edges and rolling of the edges, and obviously the movement through the different phases into proliferation.
Around what price point would the medication be for a patient with no coverage?
I think I'll turn that over to Farsan.
I think it's comparable to some of the other alternatives that are in the market, so it's at a similar price point. We're looking at anywhere between $200 to $220.
And will this cream eventually be available through community pharmacies, and if so, when?
I think for starters, at least for now, the agreement that we have is that NKS will take care of the provision of this compound for all patients across Canada, but would be more than happy to cooperate with other pharmacies and provide them with the finished product. It's just since the product is being launched in initial stages, we want to ensure the quality and the consistency of our product as it's being launched. So we can either directly provide it to the patients or provide it to provide the final product to pharmacies across Canada.
Is DELIVRA patented?
DELIVRA is patent pending. It's in its PCT stage now for numerous countries and is being reviewed by the patent office, but we hope that it will be formally patented by the 6-month to 8-month period.
When contacting a new patient, do you check their full history and any potential drug-to-drug interactions?
That's a great question. At any point of the process, the patient will have access to an NKS pharmacist, and when a new prescription is received for a new patient, the patient will be contacted, we'll create a profile, and we'll get a full history of their medication and look for drug-drug interactions as well.
Are you able to get the liver relief for neuropathic pain anywhere?
Sorry, where you can get the liver relief neuropathic pain?
Yeah, are you able to get it anywhere?
Yeah, so you can get it at any Shoppers or any pharmacy right across Canada. It's in 5,000 locations.
Can this be compounded with other drugs?
The answer is yes, and I think we're looking at some exciting new compounds, especially around the realms of neuropathic pain, and also enhancing micro and macro vascularization with different active ingredients. So the answer is yes, this space can be applicable to other products, as Dr. Gabrielli mentioned.
Yeah, our next question was, how does DELIVRA specifically compare to other delivery systems such as PLO?
Well, the delivery system is unique, disruptive, and different than PLO and other systems in the sense that it's more targeted specific. It can bring in numerous molecules with like polypharmacy, so more than one pharmaceutical or drug or natural molecule in the formulation without breaking down, up to 25%. And that's not known to work in other delivery systems.
Who can prescribe DELIVRA at this time?
Currently, physicians can prescribe it. I think that as we move forward, nurse practitioners certainly will be able to do that. And we would probably, as it gets out there and starts to get people get more comfortable with it, we'd probably take recommendations from the nurses out in the field, the wound care nurses out in the field, if they believe it is a treatment modality. That's how we're utilizing it. That they would recommend the use of it, and then the physician would prescribe it.
Are there current studies for chronic DFU in which this product is being used?
Currently, no, but we're now in the process of developing such a trial.
Does NKS do a lot of other compounding formulation work?
We do other types of compounding. As we're a specialty pharmacy, we tend to focus more on specialty type of preparations, but we also do simple compoundings. The most areas of compoundings that we're involved in compounds for rheumatology and neuropathic pain, as well as we do some sterile and IV compounding for athletes to improve from a nutritional standpoint.
How long would you use DELIVRA?
Do you want to answer?
How long can you use DELIVRA?
Correct, yeah.
Well, depending on the actual active that you're looking at. For doxycycline, it could be used, like Farzan was saying, it comes in 35 grams, so a month's supply, but it could be used for several months. There's no issue because when you deliver a pharmaceutical or natural molecule topically, you're using a very small amount of the active compared to when you're taking it orally, because when you take a drug orally, it has to go through the stomach, the intestines, it has to go through what's known as first pass pharmacokinetics through the liver, and so only a fraction of that active actually gets into the bloodstream. So when you do transdermally, like through the delivery system, targeted specific, you just need a minute amount of that drug. So you're going to prevent a lot of those unwanted side effects.
Okay, at this point, there's no further questions, so I'll pass it back in case there's any other closing comments you'd like to make.
I just wanted to say that this is an extremely exciting product, and one that has, as we have said, endless possibilities. It's left up to our imagination, and I think that the three of us, we've been putting our heads together. We have a very interesting team. Joe has come up with the ideas, and Farsan can execute. We at our center are dreaming up new ideas about how to use DELIVRA and DELIVRA-DX in different wound types. We're very excited about the possibilities in the future, and certainly we're very excited about developing a controlled trial to show how effective we believe it is. So from that perspective, we're extremely excited and very happy to be associated with this great team.